The drug industry is under siege for prices being too high. But there is another problem brewing, and that's what happens when prices are too low. You get drug shortages. Dozens of drugs, from antibiotics to pain meds to therapies for childhood cancer, are listed in shortage by the FDA, and the problem is getting worse. Meg Tirrell takes a look.
To Karen Hay, her diagnosis with bladder cancer in her 50s came as a shock.
Having cancer is not something I thought was going to happen. Nobody does, but especially at my age, and this cancer, I had barely come to terms with that.
Then, after her initial treatment, she was dealt another blow. The best drug to treat her disease wasn't available to her.
That kind of took away the last little bit of strength I had for a little while.
The drug is called BCG, a decades-old treatment thought to stimulate the immune system.
It was the first and still the most effective immunotherapy for cancer. And with BCG, we have about a 70% success rate in obliterating high-grade cells.
But there's a shortage, one that's been going on for years. Originally made by Sanofi and Merck, after manufacturing issues at a Sanofi Pasteur facility in 2012, that company stopped making BCG in 2016. And though Merck says it's more than doubled production, BCG still isn't available to everyone who needs it. That angers doctors like Ben Davies.
To say to somebody, we don't have that, and I can offer you inferior products, is decimating. It's no question that it's caused deaths.
BCG is just one of hundreds of drugs that have faced shortages, spanning antibiotics, pain medications, and childhood cancer drugs, even simple products like saline solution and sterile water. Experts blame market failure.
In general, these are very, very inexpensive drugs, and so it's not very profitable to make these products, but it's also difficult to make these products. In many cases, it doesn't make economic sense for a company to make one of these old, cheap drugs when they could make something more expensive.
Merck says it, quote, continues to work around the clock to get BCG to as many patients as we can, and that it remains firmly committed to patients and physicians when other companies have chosen to exit the market and where no others have invested in manufacturing. The drug costs $157 per vial, and patients typically get 6 vials over 6 weeks. Some question whether a higher price could address the problem, something Merck's CEO discussed in a June interview.
By raising the price, could you then manufacture more of that? Could you supply the whole market if you did raise the price?
I think this is an exemplar of a big problem that's going to continue to be here for us going forward. When the prices of drugs get too low, particularly drugs that are generic drugs, then you don't have a market incentive for people to put the capital up to build facilities like we need for additional amounts of this BCG drug. So for Merck, the challenge is how can we maximize the amount that we can make for patients, given the fact that the other two companies have now dropped out of the market. But the moral of the story is sometimes drugs are not available because the prices are too low, not because the prices are too high.
For comparison, Merck's cancer drug Keytruda, which hit the market in 2014 and has dramatically changed the way melanoma and other cancers are treated, is priced at more than $13,000 a month. It drew revenue of more than $7 billion for Merck last year.
I don't think it would be too much to ask for them to put a little bit of that money into a new facility because they have a moral obligation. They're the only manufacturer of the product.
For Hay, that the best drug for her cancer is unavailable is painful.
We are perfectly capable of making enough of this substance. Our system chooses not to.
For Nightly Business Report, I'm Meg Tirrell in Pittsburgh.